All right, you ready for this?
Ready.
Hey everyone, this is Tom Salami. Welcome back to DeviceTalks Weekly, Ep.5. I'm in my recording closet. Chris Newmarker is hanging out at a daycare center somewhere outside of in a hidden location outside of Minneapolis.
That's right.
Have the inmates taken over the asylum yet, Chris?
We're holding the line, Tom. We're holding the line.
Well, hang in there. We'll get through this together, you and me. So so this
we'll get
week
through this.
we will. We'll get. There's light at the end of the tunnel. So
That's right.
so I'm told. So we're here to talk about devices. Sorry, folks. This week we're actually looking at innovation because we've been focusing a lot on sort of manufacturing and some of the here and now of medical devices. But I had it's just an interesting two interesting conversations about where we're headed for the future and where innovation is heading and where funding is heading. So talked to an old friend of mine, Paul Grand, from formerly of RCT Technologies, but now he's in charge of the MedTech Innovator program, which is very impressive. I don't know if have you caught any of their presentations at meetings, Chris?
Oh yes, and we've actually. I mean, they run all kinds of kind of like startup contests, and we've written a lot about like the different startups that have interacted with them. So yeah, Paul's really active with a lot of startups and young companies in the space.
So we talked to him. He had a great perspective, not only on what entrepreneurs are doing to raise money, and he'll give some advice at the end of our interview, but also he and I talked a bit about events and where those are headed. MedTech Innovator has been present at AdvaMed and some of the larger MedTech meetings, but now they're starting to run more. They this week started a virtual meeting and did a virtual pitch contest there. So we talked about the value of that and where the opportunities to network might be headed going forward. So Paul has an interesting take on that. And also, I'm going to speak with a gentleman who's in Israel, and his name is Shai Policker, and he's with MEDX Xcelerator, which is a medtech incubator. He's actually optimistic about innovation, about funding. He says they're still looking at deals. So hopefully this will be an interesting and uplifting episode of DeviceTalks Weekly. First, let's visit with Paul Grand. Paul and I knew each other back in the day when he was a VC. And as we'll learn in this interview, Paul saw a gap that needed to be filled. So he has created this really, we'll say innovative program called MedTech Innovator that is giving startups the boost they need to succeed. So let's hear from Paul. Well, Paul Grand, welcome to the podcast.
Thank you very much, Tom. I'm very happy to be here.
Trying to remember how long we've known each other. It's been a very long time when you were investing on behalf of RCT, right? And now you're the MedTech Innovator guru. So it's been a good transition for you. I want to get a little more about your background and a very quick synopsis as to what MedTech Innovator is. It's a really fascinating program, and I'm not sure if all of our listeners are really up to date onto what you're trying to do with the MedTech Innovator program.
Sure. Thank you very much, Tom. So yeah, we have known each other for a while. It's been quite some time, probably a decade or so, I have to imagine. And MedTech Innovator, as you mentioned, started as a program while I was a venture capitalist at RCT Ventures. Before that, I was an entrepreneur starting companies in tech, medtech, and biopharma. So I've done quite a bit in terms of the startup world. And I guess I would say from a general perspective, if you were to think about MedTech Innovator, it is an industry effort to find technologies that as an industry we believe can really make a difference in healthcare in terms of bending the cost curve, in improving outcomes for patients, in making a difference for people, giving people the ability to live longer, healthier lives. As an industry, we want to find those companies and make sure that when we find them, we give them the assistance needed so that their technologies reach the market, reach patients, and offer the appropriate value so that those products actually can be purchased. So it's definitely an industry pipeline initiative, if you want to call it that, to make sure we've got a healthy pipeline of companies.
Did you see some sort of inefficiencies in the venture model that you created this to smooth out?
Well, what I saw was this big impact that had still been continuing as a result of the financial crisis and the subsequent exit of most brand venture investors from the medtech space. And as a result, we had all these startups out there who were still innovating, but were no longer showing up at conferences. And I remember talking to Casey McGlynn at Wilson Sonsini about that. He said, "You're right. We're not seeing these startups at the conferences anymore. And, what are we going to do about that?" And I said, well, we could do something like American Idol for medical technology, and we could put the startups in front of the stage and in front of the audience. And he said, "That sounds great. Let's do it." So that was the first time we did MedTech Idol back in 2013. We then transitioned after that to be MedTech Innovator. But it was really, an opportunity to bring the startups together with the people that I thought needed to know about them and to be helping them. And what I've seen since then is a continued problem. So going back to what I observed in 2013 still remains today, which is that the people who are supporting and funding startups in medtech and broader, I would say, in health tech, tend to not be people who have a lot of experience in bringing products to market. So they might be family offices or angel investors or tech investors classically. But as I said, most of the sophisticated med tech investors left the space, the early stage space, a long time ago, and they really haven't come back.
So, how have you sought to remedy that? Talk us through quickly just what you're doing with MedTech Innovator.
Yeah, so the microphone and talking on stage is really the smallest part, I would say, of what we do. It's important. It's a nice carrot, but it's really the program we put together, the accelerator that we run in partnership with 20 corporate partners, companies like Johnson and Johnson and Baxter and Olympus, and so on. We have really a great group of corporate partners, as I said, who are very aligned with the outcomes for these products. We want to make sure these products are actually products that would fit very well into one of those organizations ultimately and be usable and not have to be ripped apart and rebuilt or redesigned or the economics rethought. We want to make sure these products can be deployed. And so we work together with those corporate partners to identify the needs that they have, to go out and source companies that would fulfill those needs, and then once we find those companies, to invite them to pitch at in-person events where they have an opportunity to get feedback from our partners, as well as from people like investors and providers and others who are stakeholders in the industry. It could be FDA, it could be others who are participating in that, and to give them that opportunity. And then from that, we advance companies to be part of our program, which is 50 companies in our main program, another 10 companies in a pediatric track that we do as part of a FDA-funded pediatric consortium. Then we also have not in addition to our U.S. program, we have an Asia-Pacific focused program that does the same thing in the Asia-Pacific region with 20 startups there. So 80 startups a year are part of that program, and they're getting mentorship, they're getting guidance, they're getting access to the strategics, they're getting the feedback they need, and in some cases resources they need in terms of co-development or other assets to bring these products to market.
How has the fundraising process changed post COVID-19? From your perspective, how are things shifting in the fundraising world?
Well, I think the fundraising world, there's always a little bit of a lag until people react and really kind of adapt to the new environment, to the new normal. I don't think we're at the new normal quite yet. So I think there's been a scramble since the crisis, I think, became clear that it was a crisis. And so investors that we've spoken to have started looking inwardly at their portfolio and thinking about how they're going to support those companies. And that support is sometimes in financial resources. Sometimes that support is just really well needed guidance. So, it's not, the gut check, the gut reaction is always like, oh, quick, cut your burn rate and, do things that so you can survive longer. But sometimes that's not the right thing to do. And so, I think there's a lot of thoughtful discussions going on from what I've heard with startups about, whether to slow down, whether to accelerate. Obviously, clinical studies are on hold for a lot of companies, not all of them. So if they're still in oncology, for example, cancer patients are still going in for therapy and for supportive care, and so those clinical studies are continuing. And there are other people who are at home and who can't do their studies anymore, and who are thinking about how they're going to raise capital. So it's the extremes of people, and of course, there's a lot of startups who are pivoting and who are providing solutions specific to COVID and seeking support, whether it's financial or co-development, to pivot their products, or people who had products that were ready to go and maybe already approved and deployed in some way, but are now aggressively deploying those for COVID. So there's major extremes, and I think just the COVID opportunity, if you want to call it that, is providing financial support for a lot of companies. We're seeing organizations like BARDA. MedTech Innovator is an accelerator for BARDA, and for those of your listeners who don't know BARDA, it's an agency that has been preparing for a crisis like this since its inception. The whole idea of BARDA was to provide medical countermeasures for things like bioterrorism and biohazards and pandemics. They're very actively funding everything from vaccines and other treatments to technologies that can monitor patients, whether they're in the acute setting or post discharge, or hopefully detect people getting sick before they even know they're sick, and other things. So there's a lot of great work going on there. But the things that we're seeing on the funding side are in some investors who are, as I said, inwardly looking at supporting their portfolio and putting other investments on pause. So they're not out there taking meetings. Whether from home or otherwise, they're not actively seeking new investments at all. There are other investors who have, maybe recently raised a fund and are have a lot of capital to deploy, and who are still very aggressively talking to entrepreneurs and taking meetings. And then there are people who are kind of in between, who are looking at, maybe having to rethink their portfolio allocations, where they were planning on holding off on maybe committing additional capital to their existing portfolio, and we're just going to focus on new investments, but now they're reallocating their portfolio. So there's a lot of that kind of thinking happening, that's going on. I know people are taking virtual board meetings, and I think there's going to be maybe a long-term impact that I'm hoping is going to be very positive, and that people who used to only want to regionally invest in companies where they could get to a board meeting, with a drive, may get used to virtual board meetings and be willing to go a little further. So there's a lot of opportunity.
Well, speaking of virtual, you had a virtual event this week. We're obviously seeing a lot of those in the industry. Do you see virtual events like this lasting beyond the COVID-19 crisis, or is it more of a stopgap?
Well, for most people, I think it's a stopgap. A lot of the people who do who are doing virtual events really aren't set up for that and would much prefer to do them in person. And I think, and I'd include us in that category. While we run a virtual accelerator, so our accelerator program, the entire thing is done virtually. Our preference is to get together in person and to have a chance to really get to know the entrepreneurs, and for our partners to get to know the entrepreneurs and others who are there, because a lot of this really does come down to, do we want to work with these people? And it's not just, is it an important technology, but is this startup going to be receptive to our feedback? We're going to give them all this guidance and access and resource. Are they going to do anything with it, or is it a waste of time? And it's kind of hard to do that over Zoom, frankly. We're adapting and we're figuring out how to do it, and it's just requiring more diligence and more calls and more one-on-one time in addition to our initial pitches. But I will say it's more efficient to do that in person.
Just final question, and I didn't really prepare you for this one, but if someone is out there and they need to raise money, what kind of advice would you give them? Is it best to wait until things sort of warm up again and get back to some sort of normal, or what would you advise them to do to reach out, I guess, and keep their idea moving forward?
Well, I definitely suggest they continue reaching out to investors. What's very clear to me is that there are investors who are absolutely making investments right now. So you definitely want to be reaching out. We're actually putting up a resource on MedTech Innovator's website for people to give us their input or their status in terms of fundraising right now. So in addition to, we had over 1,000 companies apply this year for MedTech Innovator, which is pretty amazing. That's certainly a record for us. But in addition to those companies, we're surveying those companies for their latest updates in terms of fundraising, and then we're also asking others to let us know what their status is in terms of fundraising. So that'll be on medtechinnovator.org. There'll be a link right off the homepage shortly, and that's basically a survey where they can tell us their current status. So we're actually reaching out with updates. We're taking a consolidation of that information and sending that to investors. We have hundreds of investors who we're in contact with, so we're just going to send them updates on who's fundraising and what they're seeking, and is there a lead investor identified, and so on. So I think you should absolutely be reaching out. You shouldn't, you definitely have to be doing things like looking at PPP loans and other opportunities. But once you kind of get your house in order remotely, then and get your short-term needs taken care of, then I think the fundraising has to continue. And frankly, as Tom, as I said before, most of these brand name investors have left the early stage space anyways. So this kind of fragmented investor ecosystem isn't changing as a result of COVID. Maybe some of the angels are reevaluating their own personal portfolios and maybe not writing $50,000 checks as quickly, but people who have capital still want to make investments. And the short-term crisis of COVID, and when I say short-term, it could be 3 months or 2 years until we have vaccines and things in place. Whatever that timeline is, that will pass, and the long-term needs that we all have in healthcare aren't going away. And the need for supporting innovation is as important now, and maybe even more important now than ever before. So, entrepreneurs, keep reaching out, keep contacting investors. There's a lot of people sitting at home who might take your cold emails. Formerly, only would take an introduction email. So, this is definitely a time to continue that outreach.
That's great advice. Paul, thank you for joining us on the podcast.
Thank you very much, Tom. It's been a pleasure.
But one thing we wanted to start to get into is just tapping into the temperature that you can take over at MassDevice as to what articles are really sort of drawing interest and getting clicks and being read. So what are some of the more highly read articles this week at MassDevice?
Well, I mean, it really is, articles associated with the pandemic, and I mean, it says something that, I mean, our page views are through the roof. We're getting, just already just a few days into April, we have hundreds of thousands of page views, and I think it's just because people in the industry are just like, what is going on? Where are all the deals going on? Things are moving. We're getting, I mean, actually, some of the stuff that's really gotten the most attention, involves like, the government actually stepping in, using the Defense Production Act. Now all of a sudden we're like, seeing some really like major deals related to like getting some ventilators made, to help people across the country and maybe even around the world. One of the really big stories we just covered the other day was that Philips has, under an agreement with the U.S. government, is going to be, doubling its ventilator production by May, and this is like a $646.7 million deal, million with an M at the front deal, and the idea is they're going to get, the goal is that they're going to get us 2,500 ventilators for our strategic national stockpile by the end of May. We'll get a total of 43,000 ventilators by the end of the year. So, some stuff's moving. HHS was saying there was going to be, more deals similar to this coming. So we'll be keeping an eye out for those. So keep an eye out on MassDevice. We're going to be having more breaking news with other deals coming down.
Do you know how that deal came to how Philips got to be chosen?
Well, I mean, they're one of the major ventilator producers in the world, and I mean, and basically, I mean, the government's saying that there's going to be a total of 5, contracts coming down by within the week. So I mean, it's just almost like I'd expect like you're going to see all the major ventilator producers. It's going to be like, okay, and this is the deal we've struck with the government to
I gotcha.
provide. So this Philips, was the one of the first out of the gate. There was also, I mean, actually the first one was Trump in late May, like ordering General Motors and Ventec Life Sciences to produce ventilators. So like that got it going, and now we got the Philips deal, and then we're going to be watching out for more deals from some of the other major companies.
And at the same time, I know your coverage of 3M got a lot of attention as well, which is kind of an interesting parallel to the Philips news.
Yeah, that's another case where I mean, they were getting a lot of criticism from Trump, saying like, okay, you're selling all these N95 masks overseas. Like he was even saying on Twitter that 3M was going to have a big price to pay, but then earlier this week under the Defense Production Act, they're going to be importing an additional 166.5 million respirators from China over the next 3 months. And so now Trump on April 6th said 3M's a great company. So opinions can really change then, I guess.
Mm-hmm. And it's things can turn around, and that did seem to be a bit of a knock on the medtech industry, that whole dispute. So it's good that it got resolved fairly quickly. And as you said, we're moving forward with other ventilators. I know you had an article over at MDO as well. A couple of other companies are stepping up to build ventilators, correct?
Well, the interesting thing with the MDO article, that was about two contract manufacturers in the Twin Cities, Nortec Systems and Minitronics, looking to get going on building some ventilators. So they're seriously considering making machines based off Medtronic's Puritan Bennett 560, which was kind of like a more affordable ventilator model. Actually, just today, the news was out that that Medtronic got a emergency use authorization from the FDA to get the 560 sold in the United States. So yeah, I mean, you even got contract manufacturers getting in on the action, to produce ventilators, and I wouldn't be surprised if some of these other major contract manufacturers that we interact with a lot around the country, say, hey, we know how to make medical devices, we can make ventilators.
It makes more sense than no offense to GM or Tesla, that's for sure.
Yeah, it's true. Yeah, like an auto company. Yeah.
So that's great. So it's good to see the news on that front, and some progress made on ventilators.
Yeah,
So
really good news, and especially because I mean the governors across the country are still saying they desperately need this stuff. So I mean, it's good to know that we're going to get some more stuff produced. Hopefully, it gets produced to help some of the parts of the country like New York City that are like and really in the thick of it right now.
All right, we're going to steer the conversation back to innovation. I interviewed Shai Policker. Shai is the CEO of MEDX Xcelerator. It's based in Israel. It has backing of Boston Scientific, Intellectual Ventures, and others. And I spoke with Shai a few weeks ago. We talked a bit about COVID-19 and how it was impacting Israel. I actually removed that part of the interview from this podcast just because, honestly, it seemed a bit dated. Things have moved so quickly. So we did concentrate on funding, on how MedX does business. It currently has 6 companies that's in its portfolio. It grows them to the point where they can get institutional capital from other sources, and it's close at the time of the interview. Was close to having one of those companies, its first company, raise an outside round. So it's seeing success. And Shai had some thoughts on raising money in this day and age. Let's listen. Shai Policker, welcome to the podcast.
Thank you, Tom. Thanks for having me.
So, You wrote a piece for folks who were interested in starting up medtech companies, and it was some really helpful advice that ran in our March MDO magazine. And bringing you back today because the world's changed considerably, unfortunately, since you wrote that. And I want to understand how organizations like yours are adapting to these new times. So I think the first thing I'd like to ask you is just to tell us a little bit about MEDX Xcelerator so our listeners know where you're coming from and what your organization does.
Yeah, thank you. Well, definitely, it sounds like it was written in like a previous century or something. Definitely, things have been changing, and we are trying hard to handle the situation, keep things moving as much as possible, both for the accelerator and for the companies that we are investing in and managing. So the accelerator is a MedTech incubator. It's a private partnership, somewhat like a venture capital fund, but different in some important ways. The partners are Boston Scientific, that I'm sure you know, Intellectual Venture, which is a fund based out of Seattle. This is Bill Gates and his partners. A fund called MEDX Partners, which is MEDX Ventures, which is they are mostly interested in medical robotics. They have two companies here in Israel. So these are the three investing partners, and we also have a partnership with the Sheba Medical Center. They own 10% of the incubator. This is the biggest government hospital in Israel. It's a very, very large medical center. It's definitely the biggest in the Middle East. I think it's also one of the biggest in Europe. It was titled by Newsweek by one of the 10 best hospitals in the world, and we get access to their very wide range of facilities and physicians. So our goal is to invest in very early stage, super early stage medical device ventures. As I'm sure you know, this is never easy to raise money for seed funding for such a venture. And we are working under a license from the Israeli government, the Innovation Authority, the Israeli Innovation Authority, that basically provide us with a grant for every investment that we are doing. So from one hand, this is a private fund run by its partner, by its team. On the other hand, every time we are making an investment, about 80% of this investment is funded by the government in the form of a very convenient grant, basically a grant that needs to be paid back by the company only out of sales when they reach sales. So it's a kind of zero risk grant from the side of the fund. The government doesn't hold any equity, so we are practically receiving the equity related to this investment on behalf of the government, and it is owned partially by the incubator itself and partially directly by the partners. We are looking for things that are innovative and can have a significant impact with a large market share, and things that we can really make a difference, because the program is very structured. It's a 2-year program in which we are providing $800,000, which is not a lot of money, obviously for an early stage venture. And we will only invest in those ideas and ventures that we believe that the incubator team, together with the partners, can really make a difference. And let's say in 4 or 5 quarters, we can reach a significant, important milestone that will allow us to go out and raise the next round of funding.
Going forward, what do you think is the largest challenge for you? Is it the impact on just normal interactions with others, the inability to meet and interact and network, or are your fears more economic based, that you're just worried that the economy won't be there to support the investors who are supporting your companies and helping you bring these devices eventually to market?
So I think from the side, if I'm looking just on the narrow point of view of the incubator, it looks like our partners are strong enough. I'm actually pretty sure about this. They are strong enough to continue and support the incubator. It has been a pretty successful activity for them so far. So I am not concerned about the incubator per se, even when I'm pretty sure economics will definitely be on a very different kind of pathway in the coming months, and maybe even more than that. I do believe that there will be a shortage of investors because there will be so much good companies getting into trouble right now and on the way out of it, that the lower risk investment will suddenly be very, very attractive. So why go and risk funding a medtech venture that will take its time to reach the market, and not invest in a much more kind of mundane, simple, and still very lucrative other equity investment. So that, I think, would be the biggest challenge. And this is something I think the partnership that we have with the government and their support, and they definitely already they really moved very fast, clarifying that everything business as usual on their side. Even though that they are all government employees, they are open for business, working through Zoom and Skype and everything that we need, and they are open for new grants and investments. So we really appreciate that. So it looks like we will be able to continue and support our existing companies and even make new investments without any major impact, at least in the foreseeable future. For those companies that we have that are already in touch with investors or just closing a funding round, hopefully things will continue their course. I think I would be more concerned about those companies that are still, working on getting to this milestone, and maybe investors are not going to be as open as they were just a few weeks ago to innovations.
Interesting. Well, these are challenging times. Any advice for others out there trying to find investment or just keep their companies afloat?
Again, depending on stage, I think Israeli companies or ideas or projects that could be candidates for an incubator like ours, I think we've just either done this or doing that very soon on LinkedIn and other pathways. We are open for business. So if someone has an early stage idea and is looking for an investment, and it's in our area of expertise, we are definitely happy to look at this, and we will be trying to invest almost as usual. We are talking to people on Zoom. I think I spend now like 7 hours a day on Zoom at least. And there is no lab space. It's very hard. Sometimes it's challenging not to do face-to-face meetings. But we are, in the global world of today, we are definitely used to, doing video conferencing and communicating like that instead of just traveling. We are, by the way, we are open also to getting investment, to getting ideas and investing in ideas coming from outside of Israel. There is no geographical limitation. So we are in discussion, for example, with several American and European universities about IP and projects that they have. And this is from our side, this is going to continue. If they are on the other side, talking to us, we'll continue looking at investments.
Terrific. Well, Shai, thanks for joining us on the podcast.
Thank you.
Excellent. Well, that wraps up our discussion on innovation. Before we close things out, Paul, Grant, and I did talk a bit about events. We obviously do events here. Our Device Talks events are coming up, and we'll have some news on our June events very shortly, and some exciting new programs that we're rolling out to help the medtech world remain connected at this time when in-person events are very, very challenging. So stay tuned. We'll probably have news on our next Device Talks Weekly podcast and let you know what we're doing there. So, all right, well, that's a wrap. Chris Newmarker, where are you on social media? How can people find you?
Feel free to email me at cnewmarker, just like a new marker, at WTWHmedia.com, or you can reach out to me on LinkedIn or at Twitter at Newmarker. So, happy to hear from people.
And I can be reached on Twitter at MedTechTom. I'm on LinkedIn as my name. And you can reach me at tsalemi at WTWHmedia.com. And that's a wrap, folks. Thanks for tuning in. Please remember to subscribe to this, to share this with your friends on social media, and tag Chris and I. We'd love to be part of that conversation. And of course, tune in next week. We'll have another great episode of DeviceTalks Weekly available to you.
Yep. Always great to be here. Stay safe. Awesome. I'll find out what that giant crash upstairs was.